Good morning, everyone. Thank you for joining us for the February 2026 HMIS user meeting. Please enter your full agency name and your name into the chat for attendance. On the agenda today, we have the HMIS participating agency schedule, the HMIS data entry and performance impact, privacy and personal identifying information guidance, client consent and CES enrollment, client consent form update, Happy Fox account, system performance measure, the HIC and sheltered pit reminder, the 2026 HIC and sheltered pit data dashboard, project performance report, Goal 2, 3, and 4 overview, project performance report, reactivation training, training and resources, survey, holiday, and then we'll leave time for Q&A and office hours. To better organize your questions in HMIS, or better organize your questions, the HMIS help desk receives during the meeting. Our team recommends that you submit your questions through the Q&A option. As you can see, the Q&A option does not automatically populate anymore in your taskbar for Zoom. What you need to do is click More and then select Q&A. We request that you keep your questions general and related to the topics discussed in the meeting. Agency-specific questions is best supported through our HMIS help desk ticket submission, so our team can further investigate and provide assistance for your request. This is our HMIS participating agencies schedule. This is a sort of grand overview of all of the reports and requirements that go on throughout the year. As you can see, we have the different reports color-coded and meetings color-coded as well. I know this is a bit of an eye chart. It is available on our website, and I'll be going over a few highlights in the next slide. We are currently going through the HIC and sheltered pit. We have HIC and sheltered pit office hours on February 9th at 1 p.m. Agencies submit final HIC and pit reports to 211 OC by February 13th. Project performance report corrections. The homelessness prevention corrections will be added to your agency's Dropbox this week. If you don't have a Goal 10 spreadsheet in your Dropbox, your agency did not have exit data during the reporting period of January 1st, 2023 through December 31st, 2025. Please review the PPR webinars for additional information about running and reviewing PPR goals 1 through 10 for your agency's programs. This is a reminder regarding the HMIS data entry and performance impact. Data entered into HMIS is used to understand the characteristics of the people served through the OC system of care and how effectively clients are being served through the system of care. At the federal and state level, data is aggregated for Orange County and submitted to inform how effectively our COC is addressing homelessness as a system of care. Results of these reports impact the amount of funding for our COC will receive from these entities. At the local level, in addition to reviewing data At the county level, data is also aggregated at the project level to inform how effective specific programs are at serving clients. Local funders use this data to determine which agencies and projects they want to fund. This means that accurate and complete data entry into HMIS is critical to ensure that your agency and our COC as a whole continues to receive the funding needed to address homelessness in our community. Data entry and data quality best practices. Search for client records in HMIS prior to entering new clients to avoid duplicate profiles for the same client. Confirm name spelling and review client documentation if possible to reduce data errors for name, date of birth, and social security number. Enter data into HMIS directly instead of collecting data on paper forms. Run data quality and performance reports at least quarterly to correct errors and identify areas for additional training. Review data quality and performance correction files sent from the HMIS team and update HMIS as needed. Review knowledge base articles and training materials to understand how to collect specific data elements. This is a reminder regarding privacy and personal identifying information guidance. A reminder about client privacy and personal identifying information. Best practices for sharing client information. Users should only use the client's unique identifier to identify clients in correspondence. This includes HMIS tickets, reports, work emails, and work-related instant messaging apps. If users must share additional information such as name, date of birth, or social security number in a report or correspondence, please use an encrypted email or password protected file on your network. If you are sending a report to HMIS, please use our agency's Dropbox. And we do have the knowledge base sending client information to the HMIS help desk.
Good morning, everyone. Client consent and CES enrollment. Client rights. Per the HMIS data standards, the client always has a right to privacy and can refuse to provide their information without being denied service. However, some information may be required to determine program eligibility. Clients may provide or refuse/revoke consent at any time. HMIS is a shared data system. Consent is required to share information. If the client has a HMIS record, participates in CES, and wishes to revoke their consent to share their data, you would upload a signed client revocation of consent form, submit an HMIS help desk ticket, including the client identifier. The HMIS staff will anonymize the client record. Anonymizing a client record does not impact the Coordinated Entry System Enrollment, or CES. The client's profile will remain public and visible to participating agencies. Next slide, please. Continuing, if a client has a HMIS record, this allows agencies to continue coordinating housing referrals and services without interruption. Any agency that is still working with the client will continue to log services into their anonymized record. If the client begins working with a new agency, that agency will need to create a private record in HMIS to record the client's information. If the client does not have an HMIS record and wants to participate in CES, you would create a client profile, set release of information to no, and push the consent refuse toggle forward. and keep the profile public so you can enroll the client into your agency's program and also in any of the County of Orange's CES programs. For reference, please review our KB article, Creating Client Records Without Client Identifying Information and Refusing or Revoking Consent to Share Personal Information.
Thank you, Michaela. Before we move forward, I just want to add additional notes. We received this question during office hours and thought it was beneficial to share back with our community. Questions around CS enrollment and how to go about if a participant requests to not share personal identifying information. As shared, there is an article, How to Create a Client Record Without Identifying Information. The reason the profile needs to be public, as shared, is that there's data coordination, data sharing with enrollments as well as care coordination. So a public profile needs to be created, but the identifying information can be excluded because your agency needs to enroll the client into your program as well as switching agency access over to County of Orange to enroll in CS. So this is the steps to create that profile that is public without identifying information and still support the participant that are participating in CS. Thank you, Michaela.
Thank you, Elizabeth. Next slide, please. Client Consent Form Update. The final page of the HMIS Consent to Share Protected Personal Information form has been updated to reflect changes in the roster of the HMIS participating agencies. This form can be found on our website by navigating to HMIS Forms and Documents, HMIS Policy and Privacy Forms, and Consent to Share Protected Personal Information. A complete list of all agencies that participate in the OC HMIS can be found on our website under Contributing Agencies. Next slide, please. Happy Fox account. Creating a Happy Fox account, agency administrators can create a Happy Fox account by registering using their work email address. Once you have registered, you will receive a confirmation email. Please click the link provided to confirm your account. Once your account has been confirmed, you can log into your account here, as you can reference to the right. For information on creating a Happy Fox account, please refer to the knowledge base article, Creating a Help Desk Account. Next slide, please. Creating a Happy Fox ticket. To create a ticket, you would need to fill out the following information. Category. What issue are you experiencing, such as users in training or HMIS functionality issues? Subject. The topic of which your request is about. Message. Enter your question or issue here. Attach a file, which is optional. It is helpful to know what users are seeing on their screen, so the HMIS team could attempt to recreate the issue on their end. Please do not include any client identifying information. Full name, which is your name. Email, your agency work email. Phone, the best number to reach you. And agency, the name of your agency. Next slide, please. Searching for tickets in Happy Fox. Once you have created a ticket, you can see them all under the My Tickets tab. Please note, old tickets will not be migrated to your new Happy Fox account. You will only see on this page that you have submitted after you created your account or after they've been assigned to you. To search for an existing ticket, you can search by the ticket number, keywords of the subject, or category. Thank you.
Morning, everyone. We just want to share a quick update that the system performance measure is officially open in HDX for submissions. Our HMS team will be working with our HMS community to continue to review and address any data quality findings so that we can, when we upload it, is the most accurate data we can share for system performance. A measure that we are noticing in our COC that we have not made improvement from time to time is measure 1, length of time person remains homeless. So we wanted to highlight this and encourage agencies, admins to provide additional support with training, as well as users to have a refresher on this data element. As you're collecting this data element, we recommend referring back to the HMS data standard, as there's listed guidance on how to track this data element. As mentioned, this is data element 3.971, prior living situation. So the approximate date this episode of homelessness start. So if you're a staff that's assigned to support with intake, please work with the client and explain the fields that are included in this data element. Ask that the client look back at their history so that you can have a full picture to determine the approximate date of this current homeless episode. You can ask the client to look back at the date that they last had a place to sleep that was not on the street, an emergency shelter, or safe haven. And then also including this situation, the client that was the night before entering the program, and any movement in between the street, emergency shelter, and safe haven. And when you're looking back at that timeline, please note that if there's any stay in permanent or temporary housing situation that is less than 7 days, that does not count as a break in homelessness. And if the stay is in an institutional stay that is less than 90 days, that is not a break in homelessness. So then you can use the date that the client provided as their approximate date of this current homeless start. However, if there is a break, you would have to use the date after the break occurs. Next slide, please. So we wanted to share this visual kind of describing that timeline. So when you're working with the client, you can ask them, when was the first time you experienced homelessness? What is that date? So in our example, we're looking at January 1st, 2023. And for the first example, this client did experience a break. So there was a break between September 1st, 2024 through December 31st, 2024. Let's say they were staying in an institutional situation. So it would have been 122 days. So this would be considered a break because it is 90 days or more. So then we would track the current episode of homelessness, the date after that break. So it'd be January 1st, 2025. And in the second example, this client also experienced homelessness January 1st, 2023. There was a small break in their stay, but you can see that the break was December 1st, 2024 through the 31st, so 1 month, which is less than, let's say they're also in an institutional situation. But because it is 89 days or less, that is not considered a break. So you can, the approximate date of this current episode could be used as January 1st, 2023. And then we had a question specifically for this topic, asking what is a temporary housing situation. So in our meeting link, we did link to the data standard. It's going to list the different housing situation that is counted in each different category. So an example of a temporary housing situation is if a participant was staying with a friend in a temporary situation. Diana, if you can give me a second, I will support with navigating to the data standard and sharing that table.
Okay, let me know when you're ready to share.
Diana, I'm gonna.
Okay, let me stop sharing. Are you ready to go?
I am ready to share. Thank you.
Okay.
Diana, could you verify that you see the data standards?
Yes.
Thank you. So in the data standard, if you go to page 75 or Perks A, it's going to let you know the living situation response category and description. So before each category, it's going to list what falls under that category, that living situation. So homeless situation is the category, and it's going to list the different living situation that is categorized as homeless situation. And then institutional stay would be listed afterwards. And then temporary would be listed um, after that as well. And then the last section is current housing situation. So you can see the different options that's listed underneath. There's also going to be additional description and also let you know where it's collected. So it's going to be collected as the prior living situation. It's certain options are also then collected at current living situation, and there are some that are only collected at exit destination.
Okay, let me go ahead and share my screen again.
So I'll support with answering some of the questions in chat and Q&A, but please feel free to access our meeting link document. It does include links to these resources. Thank you.
Good morning, everyone. First, our team wanted to say thank you for all of your support in preparing the submission for this year's HIC and Sheltered PIT. We wanted to highlight some important next steps for agencies. Earlier this week, the HMIS team sent out the HIC and Sheltered PIT forms for agencies to complete. From now until the 11th, please review your HIC and PIT forms and update any data as needed. We will also be holding the HIC and Sheltered Pit office hours at 1 p.m. on February 9th for folks who may have any questions. The link to attend will be included in our chat as well as on our website calendar. We appreciate your support in reviewing these forms and the ongoing efforts you and your agencies. Next slide, please. As mentioned in the previous slide, from now until the 11th, agencies will review and correct data our team has sent out. And then our team will be hosting the HIC and PIT office hours on the 9th to answer any questions that may come up. Next on the timeline, we have February 13th, where agencies will submit those final HIC and PIT numbers. After that, we will review forms and work with agencies as needed and prepare to finalize our 2026 HIC and Sheltered PIT data to HUD. Next slide, please. Before we hop into the demo portion of the dashboard, we wanted to bring your attention to the information that we have about the HIC and Sheltered PIT dashboard in our Hick and Sheltered Pit knowledge base article. Excuse me. This dashboard can come in handy if you're checking to see what updates were made to the pit data. Each tile and section highlights a different part, and for this example, we're going to show the entry-exit-based ES active clients tile and the client details tile to the right. The emergency shelter active tile breaks down the number of clients who occupied that bed by household type. To the right, we can see the specific details about the clients who were occupying those beds on the night of the point in time. For PH and rapid rehousing projects, you will be able to use the active clients and client details for your projects as well. Please ensure that if a client is housed, you are confirming the housing move-in dates. Next slide, please. All right, and I'm going to give me just a second.
Yep. I will go ahead and stop sharing so you can share your screen, Rachel.
You, Diana, can you confirm that you see the training site?
Yes.
Okay, great, thanks. For this demonstration, we will be using the OC Clarity training site with fictitious client information. First, I will navigate to the Rubik's Cube or Launchpad. I will click on Reports. And then here on the Data Analysis tab. And then I will go to the Orange County Training System Reports and expand the selection there. I'm going to scroll down a little bit here. And then I'm going to find the Hick and Pit section. And then this report dashboard, the 2026 Hick and Sheltered Pit data dashboard. I will click on Run. And then here I have the information already pulled up in case it takes a while to load. I just wanted to save some time. And this dashboard is organized into different tiles and sections. For this demonstration, we can say that we are an emergency shelter, and we had just learned that our client, Pete Dane, had not been enrolled in our shelter program initially. He was accidentally enrolled the day after the point in time. So what we can do is we can run this report and after staff make those corrections so that we can see those changes. And let's say earlier that we showed only 2 clients in a family household here. And then now with the correction to the date, we can see that we have another household, this individual household here. And then to our right with client details, we can see the specifics of those clients, the first name, last name, and other information. All right, I'm gonna go ahead and stop sharing my screen, and that's it for me. Thanks.
Share my screen again. All right, we are on the slides again. Let me go ahead and advance them.
Good morning, everybody. As mentioned at the January user meeting, our team received feedback from the user meeting surveys expressing interest in learning more about project performance reports. We want to highlight how much we appreciate the community's feedback and encourage everyone to share ideas for future meeting topics that they'd like to see. This month, we are highlighting PPR goals 2, 3, and 4. These specific goals focus on limiting the length of time, helping clients move toward a stable housing situation. We will begin with Goal 2. Goal 2 is aimed at decreasing lengths of stay for temporary shelter and street outreach projects, meaning clients will spend as little time as possible experiencing homelessness once enrolled in street outreach, emergency shelter, or transitional housing projects. Data is collected for clients active during the reporting period for the following target goals, or the target number of days between program entry and exit. For street outreach, that goal is 65 days or less. For emergency shelter, it's 30 days or less. And for transitional housing, that goal is 180 days or less. Again, goal 2 is calculated by counting the number of days between a client's project start and project end date. And for street outreach, emergency shelter, entry exit, and transitional housing projects. For emergency shelter night by night projects, this measure is calculated as the number of bed night services provided during the enrollment period. Our team recommends agencies that operate temporary shelter and street outreach projects review the street outreach exiting protocol and project exit date knowledge base articles for client exit date best practices. Goal 3 of the PPR is intended to decrease lengths of time in prevention projects and only measures data for prevention projects. The target goal for Goal 3 is 60 days or less spent stabilizing in a prevention project for data collected on clients active during the reporting period. This measure is calculated by counting the number of days between the project start and exit dates, or the reporting period end date, whichever is earlier. Goal 4 seeks to reduce the time it takes for clients to be placed in a unit once they've been enrolled in a rapid rehousing or permanent supportive housing, other permanent housing project. Target length between enrollment and move-in dates for both rapid rehousing and PSH-OPH projects is less than or equal to 30 days. Goal 4 is calculated by taking the difference in days between the client's project start and housing move-in date. The project start date should reflect the first date the client received services from the project, while the housing move-in date is the point at which the client moved in. It is important to note that the term moved in refers to the first night that the client physically slept in the unit and not just when they've signed a lease or received a key. Users can review the Housing Move-In Date Knowledge Base article for further guidance on completing the move-in date field. And we'll go ahead and move on to the demo portion of our project performance overview.
Yep, give me a second while I stop sharing.
Thank you.
Okay, yeah, you're ready.
All right, if everybody confirm that they can see my screen.
Yes.
Thank you. We should be viewing the OC Training Agency site, and we're going to be using a fictitious client information for our demo today. As mentioned, agencies should regularly run the PPR reports for their project types and review all goals to ensure their data are meeting the targets outlined by the COC. For this demo, we'll be using the training site to find and run the project performance report dashboard for goals 2 through 4. Feel free to follow along on the training site. To locate the project performance report dashboard, you will start on the home screen. Click on the Launchpad icon and select the Reports option. Then you're going to select the Data Analysis tab. And from the options, select the Orange County Clarity System Reports dropdown. And you'll see a selection of headers here. We're going to find the one that states Project Performance Reports. And for our demo today, we'll be running the Training PPR Goal 1 through 5. A quick note that on the live site, the project performance reports are individualized by project type, meaning agencies can run the project performance reports in Clarity for each of their project types to see how their projects performed on the applicable goals. Click the Run button to open the report screen. Now that we're reviewing the report screen, I'm going to note that for today's demo, I will be using OC Training Agency as my test agency in the agency name filter. But on the live site, users will also need to adjust the reporting filter to the reporting period. Specifically, if you're looking back on a PPR reporting timeframe, you'll need to adjust it for those months. As I mentioned today for our demo, I'll be using OC Training as my agency. And to save time, I've already preloaded our results. So once I were to select the reload button after plugging in my filter options, I would hit reload and that would bring up my report results. Let's go ahead and review what we're seeing here. As you can see, we have multiple tiles, and each one of these tiles shown represents a different PPR goal. Within each goal, you'll find data for each of your agency's projects to which that goal applies. For example, here in Goal 2, these are all of my temporary shelter and street outreach projects. Within each goal, you'll find data for each of your agency's projects. And if you hover over the bars, you can see the data for each of your specific projects. For example, here I can see that my average length of stay for this project was 771 days. Let's briefly review goals 2, 3, and 4 again. PPR goal 2 is to decrease the length of stay in temporary shelter and street outreach projects. The street outreach goal has a length of stay target of 65 days or less. Emergency shelter has a target of 30 days or less, and transitional housing has a target length of stay of 180 days or less. And as you can see here, our training projects all have an average length of stay that greatly exceeds that target date. So what I would do as an agency would be to consider exploring potential bottlenecks to client exits. You can even explore other tools available to you in Clarity. Under our report library, we have the potential exits report. So you can review that and also our knowledge base articles to, refresh your memory on guidance about when to exit clients from street outreach projects or transitional housing projects or temporary shelter projects. PPR goal 3 is to decrease the length of time in prevention projects. The target length of stay for prevention projects is less than or equal to 60 days. And as you can see, my projects here, these are prevention projects, all greatly exceed the average length of stay of 60 days. PPR goal 4 seeks to reduce the time it takes for clients to be placed in a unit once they've been enrolled in a rapid rehousing or PSH OPH project. The target length between the enrollment and move-in date for both project types is less than or equal to 30 days. And one of our projects shown here, all of our projects shown here demonstrate that they are below that average length of stay. But if for whatever reason they weren't and I wanted to explore further, I could click on one of these bars here. Now, this is not available for all of the tiles that you're seeing here, but for certain goals, you can click on the bar and it'll open up the drill down feature. And this is going to take a moment to load, but it will load and you can see all the client level data. And there's quite a bit of information here. So if I'm interested in finding out which of my clients have the longest length of time between project start and the move-in date, what I can do is first find the days from project start to move-in column. And I actually have the option to sort the information. What I'll do is I'll click on these arrows here. If I click once, it'll sort the data into ascending order. Things are a little bit laggy, and I'll go ahead and click that again to sort it into descending order, which for me visually is much easier to then look at all of my clients with exceptional lengths of stay. For this client, we have 190 days between project start date, which is this column here, and housing move-in date. So I can look at the difference between these dates and consider what may have caused the delay. Again, our cap is 30 days between project start and move-in. Now, what I like about this report is that I can click on the enrollment ID, which will give me the option to go to the profile or directly to that program enrollment. So if I need to explore possible data entry errors and review the information, perhaps there's a note in the record stating that the client exited on September 17th, and perhaps I needed to record a different move-in date and update this client's enrollment status as well. So those are potential reasons, but again, you're going to be reviewing the housing move-in date field and the project start date for this particular goal. And then just to recap, some of our goal tiles don't actually have that drill down feature that you're seeing here. So what you'll need to do is, it's not available in our training site, but on the live site under the same project performance reports section, you can find the project performance details report, which will allow you to see client level data for all of the goals. And you can, it doesn't have the drill down option to go directly to the participant's profile, but you can still see client level data for all of the goals, which can be really helpful. Again, for further information about the project performance reporting and goals, please review the project performance overview document included in the links doc and the slides.
Right. Thank you, Amy. Let me go ahead and start sharing my screen again so we can move on with the presentation. All right.
That's me again. The project performance report. We wanted to alert the community that the street outreach PPR will be published in the upcoming weeks. Current and past PPRs can be found on the Orange County HMIS website by navigating to Reports, Project Performance Reports option. Corrections for the homelessness prevention PPR draft data will be uploaded into agency Dropbox this week. And the project performance overview, which is linked on the slide and in the link stock, is a helpful document that provides information regarding the PPRs, including the thresholds for each goal and the publishing schedule.
Good morning, everyone. Today we'll begin by going over the reactivation training. The HMIS team has updated the account reactivation workflow. To streamline the account reactivation process, users whose HMIS accounts were disabled due to inactivity must now complete our new HMIS reactivation training course. Moving forward, in order to reactivate HMIS user accounts, users will need to first complete the HMIS reactivation training course and then complete the HMIS skills test. Once all training materials have been completed, agency administrators can submit an HMS account update and testing form to the HMS help desk to have user accounts reactivated. I do want to note that this reactivation training course will go live once our meeting recap is sent out. Next slide, please, Diana. Training and resources. HUD Exchange resources. The fiscal year 2026 HMS data standards are now available on the HUD Exchange website. These resources include the 2026 HMS Data Standards Manual, the fiscal year 2026 Interactive HMS Data Standards Tool, the HMS data collection requirements for transition of fiscal year 2026, as well as some community resources. Helpful coordinated entry resources may be found on the Office of Care Coordination's OCCES Academy website. In addition, we also have ICES training materials and our FCS knowledge base library available for users.
And Hugo, before we move forward, just want to share a quick note. We're going to continue to share these resources. As you can see throughout our training, we refer back to the data standards. So please have these links bookmarked and have them handy to review as needed to get more clarification around data standards and reporting requirements. And for CS, our partners at the Office of Care Coordination, Friendship Shelter, and Family CS, our Unity team has additional resources that we encourage our community to review to get more context around CS. Just wanted to share a related topic since we are talking about CS. We did get a note in our chat that we just wanted to continue to encourage our partners who are in participating in CS to support with care coordination. There may be multiple agencies supporting one client when a primary agency is no longer providing resources or services to that client, to please reach out to the secondary or co-lead so that they can support with taking on the CS coordination part. Please do not exit the client if they're still actively working with a partner agency. And to do so, we recommend, attending match meeting, reaching out to the CS lead for additional guidance as needed. So thank you to our community member for sharing that note. And we'll be working with the CS lead and admin team to support with sharing more guidance as needed in future user meeting. Thank you.
Yeah, thanks so much for that tip, Elizabeth. Next slide, please, Diana. Training and resources, HIC and PIT. 2026 HIC and Sheltered Pit office hours. The HMIS team will be hosting the 2026 HIC and Sheltered Pit office hours on Monday, February 19th, 2026 at 1 p.m. As always, registration is not required to attend these meetings. Next slide, please. Data and Performance Management Meeting. On Thursday, February 19th, 2026 at 1 p.m., our team will be hosting the quarterly Data and Performance Management Meeting. On this meeting's agenda, we have project performance reports, permanent supportive housing and other permanent housing, as well as rapid rehousing projects and transitional housing. We'll also be going over the Q4 data quality report cards and be having a monthly data quality reports discussion. Once more, as always, registration is not required to attend these meetings. Please feel free to review the OC HMIS calendar to find upcoming HMIS meeting details. Next slide, please. HMIS User Meeting Survey. Our HMIS team invites users to complete the HMIS User Meeting Survey. The feedback form from the survey is used for topics at our monthly user meetings. We greatly appreciate any topics or ideas that you'd be interested in reviewing in the upcoming monthly meetings. Next slide, please. And holidays. The HMIS team will be out of office on the upcoming holidays. These are Friday, February 13th and Monday, February 16th in observance of President's Day. We will be back in office to assist you on Tuesday, February 17th. And I believe that's all for me, Diana.
You, Hugo. We've come to the end of our presentation. So we are currently in the Q&A section. So if you have questions regarding any of the topics we presented during this user meeting, please enter them into the Q&A box. And also as a reminder, please enter your full agency's name and your name into the chat box for attendance. This is very important regarding certain reporting that we do regarding user meeting attendance. So it's very important to put your agency's name and your name in the chat box. And we'll give everyone a few moments if they have questions regarding the topics we covered during this user meeting.
And Diana, I just want to share a quick note that we're going to be adding some survey links in the chat. So please feel free to give us feedback on our current February user meeting and for our HIC and Shelter Pit office hours. We're also looking for topic submissions, so please feel free to share your feedback. All the links are entered into the chat, so please feel free to take a couple minutes to share your input. Thank you. Diane, I don't see any questions in the Q&A or in chat. I
Okay.
believe we can move forward.
All right. Thank you. All right, everyone. Thank you for joining us for our user meeting today. Have a great day. Our next user meeting is on the first Wednesday of every month, and our next user meeting is on Wednesday, March 4th. If you'd like to stay on for office hours, you can, and that will allow you to ask any sort of general HMIS questions. Thank you, everyone, and have a good day.